We're going to talk about non-medication management for rheumatoid arthritis today, specifically the recent guidelines that the American College of Rheumatology put out. These guidelines came out in the fall of 2022. And again, their focus was on non-medication treatments. So not medications, not drugs, but other modalities that could be used to help rheumatoid arthritis. Now, these guidelines were developed and based on a thorough review of research that is available for the treatment modalities that they talk about. And that's a really important point, and we'll come back to why that is at the end. The guidelines were developed by a team of interprofessional experts, so a variety of different thought processes from different people with different backgrounds, and patients, so really important that patients are involved, and they achieve consensus on whether to accept or not a particular recommendation, and also made a comment in regards to how strong that recommendation was. And as we'll see, there was actually only one modality that they made a strong recommendation for. They also are very clear these treatment modalities are not to replace, but rather to complement, to accompany disease-modifying anti-rheumatic drug treatment. And if you want to learn more about those, we have other videos and information on our website for those. So here are the recommendations. So first off, they look at exercise. So as you can see here, green would be a strong recommendation. Red would be a recommendation against. And then things in white are recommendations, but conditional recommendations in favor. So you can see for exercise, consistent engagement exercise, regardless of what type of exercise, is strongly recommended. But with regards to the specific type of exercise, be it aerobic, aquatic, resistance, mind, body, these are the ones they specifically mention in their guidelines. They're conditionally recommended, but not specifically strongly. When it comes to rehabilitation techniques, they conditionally recommend a whole bunch of a variety of interventions, although none strongly. So recommended include occupational therapy, physical therapy, hand therapy, exercise, splinting, orthotics, compression, bracing, taping, a variety of joint protection techniques, assistance devices, adaptive equipment, changing environment, vocational rehabilitation, meaning job changes, doing worksite evaluations or modifications. So a whole bunch of things that are conditionally recommended. And really, if we look at this list, a lot of these things inherently make sense. They really have no harm, minimal risk, and therefore, for those who have benefit, can be significant. And certainly, many folks will have heard their rheumatologist speak to a variety of these things before. Interesting, they also make a comment with regards to diet. Again, you can see there are no strong recommendations listed in the green, but they do conditionally recommend a Mediterranean-style diet and conditionally against any other diets other than the Mediterranean style, and they're against taking any dietary supplements. And then they have a hodgepodge group of additional recommendations. So conditionally recommend standardized self-management programs, conditionally recommend cognitive behavioral therapy or other mind-body approaches, conditionally recommend acupuncture, massage, thermal modalities. Again, all these things really have minimal risk, if any, and if they benefit someone individually, that could be of great benefit to them. They are against, though, conditionally, electrotherapy. So, some things to keep in mind. These recommendations are based on available data. So if a modality has not been studied well, that means it's hard to make a broad recommendation for or against it. In other words, if we don't have the data, that doesn't mean it's wrong necessarily. It just means we don't have the data. And these guidelines are supposed to be based on the available data. So I think what a lot of these guidelines show is that we do need to do more research to better identify the benefits, risks of these variety of modalities. And of course, the other thing to keep in mind is nothing should happen in a silo on its own. Always speak with your rheumatology team about how to best integrate any of these modalities or any others that you have in mind into your overall management to ensure that you get the most bang for your buck from them so they're effective and also to ensure everything you do is safe. For more information on any of this or anything with regards to rheumatoid arthritis, check out our other videos or visit our website at albertarheumatology.com.